So if you've started a low histamine diet and you're still struggling with symptoms like digestive issues, skin issues, joint pain, you want to look at lectins. So lectins are a carbohydrate binding protein found in plant foods. Lectins are highest in foods like wheat, corn, bell peppers, beans, stuff like that. And they're known as an anti-nutrient food, and that's because they can bind to your really important minerals like iron, phosphorus, calcium, and zinc, and you get a little bit of a depletion there with that. So lectins can also be super inflammatory. They can be really hard on the lining of the gut. They can be bad for the microbiome balance of good bacteria to bad bacteria. And because the gut is such a driver of histamine intolerance, your next step in this case would be to start removing lectins. That's why in my book, I have a yes, no, maybe list. And in addition to the high histamine foods on the no list, I also have lectins in there because I noticed that a lot of people get very aggravated eating high lectin foods. And we can have lectin resistance, which means we have an even harder time with foods high in lectins, and that can come from antibiotic use, leaky gut, imbalances in the gut microbiome. So you're seeing a trend here. The gut is kind of key here, especially when dealing with histamine intolerance. And I never just reduce these foods and do nothing else. With my patients, I reduce the foods and then we look at the gut health. We look at all the things that can be driving the histamine intolerance. But in the meantime, you do need to worry about what you're eating. So we don't want to make inflammation any worse. So in this case, we would probably, the next step after reducing high histamine foods would be to reduce high lectin foods.